Welcome. In this video, we explore the link between dementia and hippocampal volume. Learn how changes in the brain can help detect cognitive decline early and how MRI can be a powerful tool in understanding dementia. Let's dive into the research. What dementia really does to your brain. Introduction. Dementia is a progressive brain disorder causing memory loss, cognitive decline, and loss of independence, mainly among the elderly. It affects over 57 million people globally, with 10 million new cases each year, and is projected to reach 152 million by 2050, WHO, 2017. The most common types are Alzheimer's disease and vascular dementia, together making up about 70% of cases. Dementia results from structural brain changes rather than normal aging. Studies show that hippocampal shrinkage is strongly linked to neuron loss and Alzheimer's pathology, including amyloid plaques and neurofibrillary tangles. Thus, hippocampal volume is an important biomarker for dementia severity. MRI is a reliable tool for detecting these brain changes. This study aims to assess hippocampal volume in dementia patients and explore its relationship with cognitive decline. Rationale. Dementia affects 57.6 million people globally, with 67% of affected people live in low and middle income countries including Bangladesh. Early diagnosis and quantification of severity are crucial for effective management. This task is very challenging in limited resource setting. The hippocampus is vital for memory, cognition and spatial navigation, which is significantly affected in dementia. As dementia advances, hippocampus show pronounced atrophy. The degree of atrophy observed in this area may help in diagnosis of dementia as well as measurement of severity. There is no available established biomarker of dementia. Although there is some research on this association in developed countries, but no data found in Bangladeshi population. Some studies found significant association between hippocampal volume and cognitive function, others did not. If this association is established, measuring hippocampal volume would be a diagnostic tool as well as a prognostic marker for dementia. So, this evaluation can help in early diagnosis, quantification of disease severity and prognosis. Rationale. Dementia affects about 57.6 million people worldwide, with most cases in low and middle income countries, including Bangladesh. Early diagnosis and assessment of severity are crucial but challenging in resource-limited settings. The hippocampus, essential for memory and cognition, undergoes marked atrophy in dementia. Measuring this atrophy may aid in diagnosing and grading disease severity. Although studies in developed countries suggest a link between hippocampal volume and cognitive function, findings remain inconsistent, and no local data exist for Bangladesh. Establishing this association could make hippocampal volume a useful diagnostic and prognostic biomarker, supporting early detection and better management of dementia. Research question. Is there any difference in hippocampal volume between individual with and without dementia? Research hypothesis. Dementia is associated with hippocampal volume. Objective. General objective. To evaluate the association between dementia and hippocampal volume among participants. Specific objective. To measure the severity of dementia with MMSE scoring among participants. To measure hippocampal volume in demented and age-matched non-demented participant with MRI. To measure the correlation between hippocampal volume and severity of dementia. Research question. Is there any difference in hippocampal volume between individual with and without dementia? Research hypothesis. Dementia is associated with hippocampal volume. Objective. General objective. To evaluate the association between dementia and hippocampal volume among participants. Specific objective. To measure the severity of dementia with MMSE scoring among participants. To measure hippocampal volume in demented and age-matched non-demented participant with MRI. To measure the correlation between hippocampal volume and severity of dementia. Review of literature. Studies consistently show that hippocampal atrophy is strongly linked with dementia severity and cognitive decline. Vijayakumar et al. 2013, and Vasta et al. 2018, found significant hippocampal volume loss in Alzheimer's and vascular dementia. Kantarchi et al. 2016, noted that preserved volume predicted Lewy body dementia, while reduced volume indicated Alzheimer's. Gentro et al. 2023, and Heyer et al. 2010, reported that smaller or faster shrinking hippocampi predicted future dementia. Meta-analysis by Sarika et al. 2018, confirmed bilateral hippocampal atrophy, greater in Alzheimer's than in mild cognitive impairment. Overall, hippocampal volume is a promising biomarker for diagnosing and tracking dementia progression. Methodology, study design, cross-sectional analytical study. Study place, Department of Medicine. Study period, September 2023 to September 2024. Study population, patients diagnosed with dementia and age-matched non-demented participants from medicine and neurology OPD and IPD. Data collection tool, structured questionnaire. Sample size, calculated using statistical formula based on hippocampal volume difference, Dolek N. et al., 2012. Total sample, 20, 10 demented, 10 controls. Sampling method, purposive sampling. Selection criteria, inclusion, age is greater than or equal to 60 years, diagnosed dementia, age-matched healthy controls. Exclusion, delirium, psychiatric illness, metabolic or structural brain diseases, MRI contraindication. Study variables, demographic, age, gender, education, income, smoking. Clinical, MMSE score. Laboratory, right and left hippocampal volume, total brain volume on MRI. Study procedure, after ethical approval, 10 dementia and 10 control participants were enrolled with written consent. Clinical evaluation was done using MMSE and MRI brain dementia protocol. Data analysis, data analyzed using SPSS v25. Descriptive statistics, t-test, chi-square, and Pearson's correlation used. P less than 0.05 considered significant. Ethical consideration, approval obtained from IRB of SSMC. Informed written consent taken. Confidentiality and voluntary participation ensured. Table 1. Demographic characteristics. Demented participants were slightly older, 73.25 plus or minus 9.87, the non-demented, 69.12 plus or minus 8.55, but not significant, p equals 0.331. Female predominance was higher in dementia group, 70% versus 40%, p equals 0.001. Lower education levels were observed in demented participants, 40% illiterate versus 0% in controls, p equals 0.004. Income and smoking status was similar between groups. Table 2, Severity of dementia, MMSE, mild, 20%, moderate, 30%, severe, 50%. Most participants had severe cognitive impairment, reflecting advanced dementia. Table 3, right hippocampal volume. Demented participants had significantly smaller right hippocampal volume, 1.24 plus or minus 0.50 cc, compared to non-demented, 2.55 plus or minus 0.36 cc, p equals 0.001. Majority of demented participants, 80%, had volumes 0.70 to 1.49 cc, controls mostly 2.00 to 2.99 cc. Table 4, left hippocampal volume. Left hippocampal volume was also reduced in demented participants, 1.22 plus or minus 0.50 cc, versus controls, 2.55 plus or minus 0.36 cc, p equals 0.001. Atrophy pattern was similar to right hippocampus. Table 5, right versus left hippocampal volume in demented participants. No significant difference between right, 1.24 plus or minus 0.50 cc, and left, 1.22 plus or minus 0.50 cc, hippocampal volume, p equals 0.930. Suggests symmetric hippocampal atrophy in dementia. Table 6, gross brain volume. Demented participants had lower gross brain volume, 1139.73 plus or minus 132.54 cubic millimeters, than non-demented, 1403.21 plus or minus 124.19 cubic millimeters, p equals 0.001. Confirms global brain atrophy in dementia. Figures 1 to 3, visual distribution of age, gender, and education aligns with Table 1 results, older age, female predominance, and lower education in demented participants. Figures 4 to 5, right and left hippocampal volumes were smaller in demented participants, consistent with Tables 3 and 4. Figures 6 to 7, positive correlation between MMSE scores and hippocampal volumes, lower volume associated with lower cognitive scores. Discussion. In this study, the majority of dementia patients were aged 71 to 80 years, with a mean age of 73.25 plus or minus 9.87 years, slightly higher than non-demented participants, 69.12 plus or minus 8.55 years, supporting age as a risk factor for dementia. Females and individuals with lower education levels were more affected, consistent with global and local studies. Monthly income and smoking showed no significant association with dementia. MMSE scores reflected moderate to severe cognitive impairment in most dementia patients, mean 12.70 versus 27.50 in controls, aligning with previous research. Hippocampal volumes were significantly reduced in dementia patients. Right hippocampus 1.24 plus or minus 0.50 cc versus 2.55 plus or minus 0.36 cc, and left hippocampus 1.22 plus or minus 0.50 cc versus 2.55 plus or minus 0.36 cc, p equals 0.001, indicating strong correlation between smaller hippocampal volumes and cognitive decline. No significant asymmetry between right and left hippocampal volumes was observed. Gross brain volume was also significantly lower in dementia patients, 1139.73 plus or minus 132.54 cubic millimeters versus 1403.21 plus or minus 124.19 cubic millimeters, p equals 0.001. Overall, the findings confirm that reduced hippocampal and brain volumes are associated with dementia and may serve as useful structural biomarkers for diagnosis and monitoring disease progression, consistent with prior studies. Conclusion. In conclusion, the study findings demonstrate a significant association between hippocampal volumes and the presence of dementia. Mean hippocampal volumes of both right and left sides were significantly lower in the dementia group. So hippocampal volume measurement is a valuable biomarker for the diagnosis of dementia, as well as quantifying the disease severity and enlightening the management accordingly. Limitations of study. The sample size of the study was small. The study was carried out in single center, purposive sampling might have biasness recommendations. From the findings of this study, we recommend to carry out large multi-centric prospective study. Future research should continue to refine these measurements and explore their integration into clinical practice for personalized dementia care. Thanks for watching. This study highlights the importance of hippocampal volume in diagnosing and tracking dementia. Don't forget to like, share, and subscribe for more insights into medical research and brain health.